running medical rounds as students get ready now to go back to college. How can they stay safe off campus? Channel 3's Kara Sunland is getting some answers, including testing.
As students get ready to go back to college, how can they stay safe on campus? Connecticut College will be the newest member of Hartford Healthcare's growing campus care program, which provides services for more than 8,000 students and 1,300 athletes at campuses across Connecticut, including Trinity College and the University of Hartford. I am joined by Keith Grant. He is a Senior System Director of Infection Prevention, also a nurse practitioner with Hartford Healthcare. Thank you for being with us.
Thank you for having me.
It's a big, monumental task, but how can students stay safe? Let's start with even in the dorm.
So, do you know, we have a really good model in Connecticut in that we've done this before. So we've closed health system partially, we've closed the state for the most part, and we've reopened with very good success. So I would say do exactly what we've done so far in that, you know, universal masking, proper usage of PPE, definitely being aware of their symptoms, reporting symptoms as soon as possible, simple stuff such as hand hygiene, identifying any risky behavior and try to avoid them as much as possible. And I would absolutely advocate for working and communicating as a group, and I think a lot of systems have done that very well in preparing for this so far.
Now, a lot of schools are talking about quarantining students when they first come onto campus. How important is that, and testing?
So testing, I'll talk about testing really quickly before I get to quarantine. So the things that got us to this point, so primarily information going out to the general public as to what they need to do. The other set of information that's really helped significantly for us is information that we've gotten from testing. So it helped us for predictive modeling. It helped us to make critical decisions such as reopening, when to reopen, right? And help us to know where prevalence is and what population we need to focus on. So with campuses, the constant monitoring that will be on there on campuses, so the routine testing will be quite significantly helpful in helping us getting data so we could respond to if something comes up. Where quarantine is concerned, we have multiple students that are coming from geographical locations away from Connecticut with different prevalence. Now, if parents implement a form of early quarantine, I'd say about 7 days to 2 weeks before you get to the campus, and then once you get on campus, another set of quarantine for about 7 to 14 days. That should give the campus an idea of any incubation period that needs to happen from exposure before campus. You'll hopefully capture it. And then the testing and the quarantine with incubation period considered, when you get on campus will also be covered.
Okay. And I know there's a lot of information. Parents are getting information from their schools, but we just want to thank you for sharing this brief time with us just to give people an idea of what's necessary to stop the spread.
Absolutely.
Thank you.